For a lot of you guys, like where the Overton window is in the United States is a very emotional topic, and people get really mad and your brain shut off. So this is why I was typing in chat earlier instead of talking, because it's fucking stupid to talk about. Like all of these posts are so fucking retarded. For first of all, I don't know why you would compare wages in 2023 when Warren was running in 2020, because I'm pretty sure they've changed since then. But the single-payer healthcare thing, like this here, my understanding is, somebody can correct me if I'm wrong, so this person is using the UK's NHS as a comparison to what Warren and Bernie Sanders are pushing. My understanding is that, somebody correct me if I'm wrong, well, wait if you want, okay? In 2016 as well. My understanding is that in the United States, Bernie Sanders and Elizabeth Warren wanted a single-payer healthcare system in the United States where I believe the hospitals and the insurance were owned by the United States government, and it covered dental and vision as well. My understanding is that there is not a single other country on the planet that has a medical system set up like that. If any Europeans in the chat want to submit something to the contrary, do so now and let me know. I don't believe there is a single country in all of Europe that does that. Destiny, is there support for a 15-hour minimum wage? I don't believe there is support for a 15-hour minimum wage in the United States. When we tried to get it passed in Congress, it failed fucking miserably.
Aren't you going to say anything about the nuke you just dropped on a girl on Twitter?
Nope. In summary, the UK system of education is not totally free for most people, but it is nothing like the United States. Tuition fees in the UK used to be completely free up until 1998, and fees were minuscule up to 2011. They started to up fees on UK education, but I'm pretty sure Elizabeth Warren and Bernie Sanders, I'm pretty sure they wanted to make education free from grade 1 to postgraduate. That was my understanding. Like, you guys are taking the most, like, watered-down version of the things that these people were asking, right? Even the 15 an hour minimum wage thing was just like the start. I'm pretty sure that Bernie and Elizabeth, I think both of them also supported a federal jobs guarantee. Does that exist in any European countries? I'm not sure about that. Number one. I'm trying to think of number two. Bernie Sanders, and I think AOC talked about this at one point, the idea of taking 20% from every single corporation. I don't remember if Warren was on top of this as well. But I'm pretty sure Bernie Sanders was saying that 20% of every single corporation should be given to the workers. So, I mean, like, so to compare, like, the straight dollar minimum wage today from the U.S. To these countries, and then to say, like, oh, well, the NHS exists, that's kind of like the single payer they were advocating for. Oh, well, free education, it's a lot cheaper in Europe than it is here. Wealth taxes are not too common in... I think there's like there might be like a couple countries in the UK, not in the UK, in Europe that have a wealth tax, but I don't believe that wealth tax are very common either. It's just like, this is fucking retarded. Isn't this a bit of a Mott and Bailey to suggest that because the UK doesn't cover full dental and eye cover, it covers some for poorest, youngest people, that we don't have single payer, and so it is somehow a far left policy? If a political party in the UK advocated for free dental and eye cover in the UK tomorrow, I don't think many people would bat an eye. You don't think so? If somebody came, here's a question. If somebody in the United Kingdom was saying we need to expand the NHS to also cover all dental and all vision, and we need to get rid of all the copay so that all of it is free at the point of care, that wouldn't be a pretty far left position in the United Kingdom? It would be welcomed massively by both sides. Then why doesn't it exist now? How are there policies in the UK that could get passed that would be massively welcomed by both sides, but they're not passed by anybody? There's also the thing where a lot of you guys in the United States, fuck, I don't have my articles on this anymore, but sometimes when I Google, like, who has single payer or whatever in Europe, countries will come up that I'm pretty sure aren't actually the single payer systems that Warren was advocating for. Like, I think, like, France will come up as single payer, and I think in France, you could have private insurance as well.
So you support these brain dead obvious things.
Yeah. But Elizabeth Warren and Bernie Sanders wanted to abolish all private health insurance. No private health insurance. That's a really far left position. France has it. Can you have private medical insurance in France? In France, can you have private insurance? Okay, so you're wrong. Who are you? Are you a Frenchy fuck that doesn't even know how your own fucking shit works? Or am I wrong? Am I missing something? Well, hold on. I'm sorry. When I say they have single payer, this is what I mean. You guys might have it so that in France, all of you are covered and all of you have like a state-provided insurance, but you also have the option to buy private insurance too. Elizabeth Warren and Bernie Sanders wanted to abolish all private insurance in the United States. They didn't even want to have, these are considered multi-payer systems, not single-payer systems, right? But a lot of the multi-payer systems that exist in Europe, a lot of people in America call single-payer, but they're not single-payer. And apparently even some Europeans call them single-payer, but they're not single-payer. They're multi-payer. You have the opportunity to top your shit off with private insurance as well. Is there literally any country with a single-payer system? I believe there are a few European countries that have a true single-payer, no private insurance system. I think there are a few, but I'd have to go start digging through it because people use single-payer interchangeably with multi-payer a lot. Yeah, when Warren and Sanders were backing their Medicare for All plan, they wanted to abolish all private health insurance. They didn't want any private health insurance at all. Every single thing was supposed to be provided for by the government. Destiny outright lying about the Bernie proposal. I literally just linked it right here. What do you think I'm lying about? Senator Elizabeth Warren used Wednesday night's Democratic debate to come out unequivocally for a Medicare for All plan that would abolish private health insurers. The Massachusetts Democrat was one of only 2 candidates to raise their hand when moderator Lester Holt asked for a showing of who would be willing to get rid of private health coverage in front of government-run systems. Bill de Blasio was the other. Was Bernie not? I'm pretty sure Bernie came out in favor of getting rid of private health insurance as well. I don't know if he either wasn't here or it was literally in the legislation Bernie wrote. Yeah, I'm pretty sure this was like this. She bit this from Bernie Sanders. Oh, it's this. Warren in April signed on to Senator Bernie Sanders' Medicare for All plan, but has also stressed the importance of taking interim steps that extend cheaper free insurance people. Taiwan, Canada, and South Korea all have true single-payer systems. I thought you could buy private insurance in Canada. Destiny spending too much time in conservative... Okay, what fucking off. Yeah, see you later. Good one. I think you're using a definition of single payer that is more strict than most people use. That's fine if you want to say that. If you want to say my definition is more strict, that's fine. But if you just talk about the policy itself, Warren and Sanders' policy was more extreme than any other country in Europe. I don't know what else to... I don't know how else to put that. Do you agree with single payer with or without private? At the very least, I'm in favor of a public option. I don't think that having, I'm not necessarily opposed to single or multi-payer systems. Whatever we're doing right now in the United States does not work. And I've heard from too many people that the bureaucratic overhead is like way too high right now with all the private insurance companies. So I don't think I would necessarily be opposed to, I don't know what the answers are, dude. I don't know what the answers to anything is. One of the things that I heard, I talked to a nurse that worked at the NHS when I was in Bongerland, and I don't know how true it is because it's just one fucking person, but something I heard from her that was pretty disappointing was she said that one of the big problems with like wait times and insurance in the NHS is that there are like, oh God, what did she call this? She called it like, did she call it path care? Or
no hard feelings, buddy.
Paths of care or
DDG.
something? Or does this make sense? Does this sound like anything? That that one of the issues in the United Kingdom is that if you identify any sort of like part of an illness, there is like set treatment paths that you have to send everybody down. And doctors have very little wiggle room when it comes to like prescribing medications or when it comes to maneuvering around, pathways maybe? I don't know. I don't know if there's an actual name for NHS pathways or whatever. She said that a lot of people do weird and fucky shit when it comes to like you might say that like a patient probably needs an x-ray, but the pathway doesn't suggest it. So you might say, well, maybe the patient has cancer, and then you send them to another part of the hospital and they know they don't have cancer, but they're going to do the x-ray anyway because the doctor recommended it because they couldn't get on it. Like there's like a lot of like weird, there's also like a lot of weird bureaucratic shit that goes on in the NHS as well. That was one example she gave. I don't know how much like any of this stuff contributes to the overall cost or wait list or shit like that. But yeah, because she said that depending on what you do in the NHS, you could like be looking at like a 40-week wait time and stupid shit like that. Oh, NHS Pathways. That's what it was. But I have link muting on, sorry.